Good afternoon, everyone. I call Committee of Supplies Section A to order. We're meeting today to continue consideration of the estimates of the Ministry of Labour. I now recognize the Minister to move the vote.
Thank you, Honourable Chair. I move that the vote number 36 resolved that a sum not exceeding $17,374,000 be granted to Her Majesty to defray the expenses of Ministry of Labour, Ministry of Operations to 31st of March 2022.
Thank you, Minister. I now recognize the member for Shuswap.
Well, thank you, Mr. Chair. Bill 13 came into effect with royal assent, which I believe was on May 20th, which would mean that employers are now obligated to provide paid sick leave. Can the Minister just share with us how far they are along with developing the criteria by which employers can determine their eligibility for reimbursement?
Minister.
Thank you, Honourable Chair. To the member, the program is being developed. As we said that we want to move ahead as quickly as possible because this program was needed. So they are still developing it, and I'm advised that within next few days it should be up and running, and then the more details will come out.
Member.
Thank you, Mr. Chair. Through you to the Minister. A few days, is that 2 days, 10 days, 20 days? So through you, Mr. Chair, to the Minister, if you just provide a bit more clarity on when the program will be fully developed and available for employers to make application.
Minister.
Thank you, Honourable Chair. Mid-June, I would suggest.
Member.
Through you, Mr. Chair, to the Minister, thank you for that. So mid-June will be the date by which the program will be fully developed. And at this point in time, is the eligibility criteria, is it fully developed and is it available for employers to assess, to look at, to review, and further that? Has a Q&A document actually been created yet, which will provide additional certainty for employers to determine their eligibility for this program?
Minister.
Sure. As I said, the program is still being developed, and they're looking at all kind of different details. And once it's fully developed, we're expecting to be up and running by mid-June. And then all the information that the member talked about, the Q&As and how you qualify, how you apply, all that will be available in the coming days.
Member.
Thank you. Through you, Mr. Chair, to the Minister. Can the Minister provide any additional clarification on if there's been any other consultation with business owners to determine how the program will actually work, how it will function, as has been evidenced by many of the questions that I've queried both through committee stage when the bill was actually going through legislation, as well as here over the last 2 days now through estimates, that there's seems to still be some uncertainty about eligibility. And so just through you, Mr. Chair, to the Minister, has the Minister or is the Minister's office undertaking any additional work to do additional consultation with businesses to identify any unintended consequences with respect to the development of the program, or is it just being undertaken directly by staff?
Minister.
Thank you, Honourable Chair. So now that we know that the bill is passed, the royal assent is received, and now we have, gave the Works at BC go ahead to start developing the program because they have connection with the employers already, and they will be utilizing their system in order to make it speedy and expedient. And the details will be worked based on the discussion we're having here in the House. That the Works at BC will be working with the ministry to develop the final details. Once by the time that the program is fully developed, so all of that will be considered, and then they will be putting those details together.
Member.
Thank you, through you, Mr. Chair, to the Minister. As a follow-up to that, so the Minister has indicated that WorkSafe BC will be working with employers. Can the Minister share with us specifically what industry sectors are being covered by the consultation that WorkSafe BC is undertaking with the employers that the Minister has referenced?
Minister.
I want to correct the member. I didn't say that they will be working with employer. What I said was the ministry and the WorkSafe will be working together to develop those details based on the guidelines that has been part of the bill. And of course, they have connections with all type of industries and all sectors of the industry. And so they know the connections, they know what to do in order for them to reach out to the employer if they wish to. But the program is being developed between the ministry and Works at BC.
Member.
Thank you, Mr. Chair. Through you to the Minister. So as this program is being developed, there will be no further direct consultation with different business organizations. It will be fully developed through work within the Ministry's office and in conjunction with WorkSafe BC. Once the criteria is developed, through you, Mr. Chair, to the Minister, can the Minister indicate once the criteria is fully developed If there's any additional questions, will those questions be identified and adjudicated directly by WorkSafe BC, or will the ministry actually have a hand in actually providing guidance and direction to the development of any further criteria that may be required to provide additional clarification for businesses?
Minister.
Thank you, Honourable Chair. WorkSafe BC is acting as a payer on behalf of the ministry, so the funds will be transferred to them and they will be paying. We have canvassed this issue wide WorkSafe BC because the obvious connection that they have with over 90% of the employers in British Columbia. So they have connections, they know the contacts, they know who they are, and but if there are some issues arising out of details, then the ministry will be dealing with it, working directly with employers.
Member.
Thank you, Mr. Chair. Through you to the Minister. Previously, it was my understanding that the Ministry of Finance would be providing the funding to WorkSafe BC. With respect to the development of the criteria, is the development of the reimbursement criteria, does that responsibility lie solely with the Ministry of Labour, or is the criteria and the responsibility for the development of it being developed by the Ministry of Finance? Just looking for a bit of clarity on which entity actually has the responsibility for the development of the criteria.
Minister.
Thank you, Honourable Chair. It will be a Ministry of Labour working with other parts of the government, possibly the Ministry of Labour, Ministry of Finance, because that's where the funding is going to come from and flow from. But we will be developing the criteria, but we are ultimately responsible as a Ministry of Labour to help design the criteria, help design the details, and then using WorkSafe BC to provide that service. So the money will flow, and then they will be following the criteria that will be developed between the ministry and WorkSafe BC.
Member.
Thank you for that. Through you to the Minister. So it'll be the Ministry of Labour that has the responsibility for developing the criteria for the reimbursement program. Can the Minister, through you, Mr. Chair, to the Minister, can the Minister provide or advise this House if the proposed $320 million program If it is actually oversubscribed, I'm just wondering if the minister could share with this House or give certainty to businesses that should this potential $320 million program, if it is oversubscribed, if there would still be opportunity for businesses to continue to make application for reimbursement. And I guess the further question that would be is that has the Ministry of Finance approved expenditures in excess of $320 million should this program be oversubscribed above the 60% utilization rate that I believe that the minister had initially indicated was the estimated uptake for this particular program?
Minister.
Thank you, Honourable Chair. Well, the ministry, when they put these programs together, they look at what is the practical scenario there is. And when you look at these numbers, a million workers have no sick leave provisions currently. And so 60% of them, if they use 60%, that's a 600,000 workers, Mr. Speaker, using all 3 days. I mean, it'll be. I mean, you know, anything is possible, but I could tell you that our estimates are well, I think, within the program, and all the assumptions are, you know, they use the kind of a worst case scenario. Considering also, as I said earlier, that our vaccination program is a success, is the talk of the country, if not the world. 70%, you know, people of British Columbia have been vaccinated, and most of them are working age groups. So when you look at the history of those who are vaccinated, at least with one shot, their chances are, or the risk of them getting sick with COVID-19 is much, much lower. So we don't believe it's going to go over. So we are confident it'll be within 320, and those are the estimates.
Member.
Thank you, Mr. Chair. As a follow-up to that, the minister and the ministry must have contemplated that, you know, we certainly can't foretell what the future may bring. Should the utilization rates of this particular program be in excess of 60% and the total cost be higher than $320 million, the legislation that's put in place and this temporary program, is certainly my understanding and understanding of British Columbians that have been watching the debate in the legislature, are of the understanding that the reimbursement program will be available for any of those companies making application to December 31st. And certainly not a trick question. I'm just trying to get some certainty that should the program cost exceed the $320 million that the minister has actually identified as the estimated cost of the program, there could be likelihood where the cost could be less, but should the cost be higher, is the minister bound by the $320 million, in which case, if it is oversubscribed at some point in time, it would be cut off, or would the minister provide clarity and certainty to businesses that the temporary relief provided through this reimbursement program, which is set or scheduled to be in place until December 31st, that will it be fully funded regardless of whether it's over the $320 million threshold that the minister has announced?
Minister.
Thank you, Honorable Chair. I think, we could go into all kind of hypothetical questions, but the ministry, they are very prudent people, and they have gone through it, and this was the kind of a high-end estimate because they want to make sure that we are covering the cost of the program that we are delivering, and in a high-end area, the worst-case scenario, you may call it. So that's why 60%. Think about if you go back to the beginning of the pandemic, how many people in British Columbia have been inflicted with COVID-19? Not 600,000. So I think we're talking about only a few months, and vaccination program now is, very, very robust, and 70%. I think next few weeks we'll be talking about when we move into the next phase, June 15, it'll be much higher. July 1st, it'll be a much higher. I think you're talking about, almost 75, 80% by that time. And people are getting their second shot now, and many people already have shots, but now they are being approached. I'm one of them. I just had a text yesterday that I can schedule for my next shot, the second shot. So I think we're very, very confident that these are the numbers. The ministry people put them together using the estimates that they do, and but there's no way that I could answer any hypothetical question. It could be, I think if anything, it probably will be lower.
Member.
Thank you, Mr. Chair. Well, the estimate is hypothetical. The estimate of the number of workers that are currently not covered under a paid sick leave program is based on an estimate of 50%, and that was undertaken, I believe, by the Federation of Labor. That was their high-level estimate of the number of workers that currently don't have access to paid sick leave in the province of BC. The 60% is an arbitrary number. Maybe I'll pose my question this way, through you, Mr. Chair, to the Minister. Is the Minister aware of what the current uptake or utilization rate is of existing paid sick leave programs, say even within the Ministry of Labour, within the Minister's own office, paid sick leave programs that are available within his own ministry? Is the Minister able to share what the utilization rate of those programs? Is it 50%, 60%, or is it indeed 100%?
Minister.
Thank you, Honorable Chair. Look, I think these are, first of all, to begin with, these are two different programs. Many employers who have sick leave provisions, sick and injury leave provisions, they're sick and injury leave provisions. This one is a COVID-related illness. So they're two different things. So it does, both of them, there's no correlation between one or the other. And also, I think there's no requirement by employees or by them to report it to the ministry. So I think what the assumptions that they made. Assumptions are made all the time. That's where the actuaries are out there. WCB has them, the Ministry of Finance has them, others have, all pension plans has them. They made assumptions based on the criteria that is established, and criteria was established. I think they took the high end, 60%. I don't believe 60% of the employees will be utilizing all of them, all of the benefit that they have. But, they may, but that's the cost, 320 million, if they all do. And so they took at 60% of all employees who would be eligible under this program, for those employers who don't have a current sick leave provisions. So the estimates, based on the assumptions that they make, they're very prudent people. They do it all the time, and I think these are the assumptions that what they made is, I'm confident about the assumptions. It'll be 320. I think, my personal feeling is, I'm not actuary, it'll be less based on the vaccination program, the success of the vaccination program, and how our case numbers are going down. So the trend is, going in a positive direction, of lower cases with COVID-related illnesses. So I think, we're looking at brighter days and the light right there, because I think we will be saying that we have pushed the pandemic behind us, not too distant future, and then there will be less need for this program. So we're talking about between now and December 31st. We'll have a discussion about the other program after, through consultation, but right now that's what it is.
Member.
Thank you, Mr. Chair. In the minister, in his response, he referenced prudent calculations, prudent forecasts, prudent estimates of the potential cost, I think, and referenced the use of actuaries. And through you, Mr. Chair, to the minister, can the minister share with this House whether the professional association that an actuary was actually involved in determining this 60% threshold that the minister has used in his calculation?
Minister.
Thank you, Honourable Chair. Look, I think we've gone through this, how we arrived these numbers, and I think 10 different ways possibly. The ministry people went through the process that they need to go through in order to come up with the total amount, using the assumptions, and next thing could be, who was the actuary? What's the name? Mr. Speaker, I don't think, Honourable Speaker, we need to get into all those details. I think the process was used. The ministry people used the normal process, whether it was a Liberal government before or a government now, to come up with the budget for different programs that any ministry does. And this is no different. They looked at the program, looked at how many possible employees are out there who don't have paid sick leave provisions right now, and what is the possibility of them utilizing this, and by how much. And I think they came up at a worst case scenario, 600,000, 60% of all eligible workers who may utilize this, who are eligible for this, 60% of them, using all 3 days. And that was done at a time when our vaccination rate was much, much lower, and we had a higher case numbers. So they looked at all of that, and then they came back, said, look, we're confident if these assumptions are there on a high end, and the cost of the program will be $320 million, so I'm confident that we will be within the budget.
Member.
Thank you, Mr. Chair. Through you to the minister, it was the minister that raised the idea of using an actuary in his last response. I didn't ask for him to reference the use of actuary in trying to identify, and I think maybe provide some clarification to this House, that prudence was actually undertaken, and the work of the ministry and staff were undertaken to give a high level or a high degree of confidence that the 60% number is correct. The minister referenced actuary. And so one more time through you, Mr. Chair, to the minister, can the minister confirm whether the services of an actuary were actually utilized in developing and coming up with this 60% threshold that the ministry is relying upon?
Minister.
Thank you, Mr. Speaker. I think I use a broader example how different organizations come up with assumptions, come up with a cost to a program, how they utilize actuaries. But in this particular case, I'm coming back to that I have confidence in the ministry who engaged, whoever they engaged, to come up with the numbers based on the assumptions. And I think these, in my view, are the appropriate assumptions that they made. And I think they are at the high end. But looking at the vaccination programs, the utilization, in my view, would be much lower. And I think we will be well within, much lower than what $320 million that is available for this program. But again, we're ready. If all 600,000 use them, all 3 days, then $320 million is plenty.
Member.
Thank you, Mr. Chair, and thanks to the Minister for that additional clarity. The Minister seems to have a high degree of confidence. I don't know if business owners necessarily do. Back to the original question, is that should this program be oversubscribed? And I'm sure that the Minister has a high degree of confidence that 60% will be the highest amount of utilization rate, but we don't know. It could be higher, it might be lower. Through you, Mr. Chair, to the Minister, should the program participation rates or reimbursement exceed the $320 million, will government provide additional funding to ensure that business owners are eligible for reimbursement for their entire costs between now and December 31st? Through you, Mr. Chair, to the Minister, I think the answer is either yes, no, or to be considered later. It's not a trick question. I'm just trying to get some sense of whether the $300 million program estimated cost, if that's a hard cap, or if the program is utilized higher, and none of us can determine what might be down the road. Nobody in the months of December of 2019 anticipated that we'd have a COVID pandemic upon us. So, I'm not trying to be cute in any way, shape, or form. I'm just trying to get a sense of whether the $320 million program is fixed, or if government would give consideration to additional funds for that program should the necessity require.
Minister.
Thank you, Madam Chair. I think I've answered this question more than once, and I will say it again. The cost estimates, I believe in it. They're reliable, and they were at the high end at a time when the vaccination rate was much, much lower. And so they consider all of that. That's why 60%. They could have easily said 50%. They could have easily said 40%. And they could have looked at any different numbers, but they believe that the right number on a high end is 60%, and at $200 per day per worker, the cost would be $320 million. And I have confidence in our staff. Member may not. I have full confidence. Many of them are still working here when they were working in the previous government. So I fully believe in their capability and the skills and their knowledge and their ability. And I'm confident that this program is going to be $320 million, provided that all 600,000 utilize it the full amount of 3 days.
Member.
Thank you, Mr. Chair. The reason that, or a big part of the reason, I guess, we're taking so much time to develop this is the ministry itself, the budget for the ministry is $17 million. This is a $320 million program, significantly higher cost than the minister's own budget. And even a 5 or 10% variation on the utilization rate can make a significant impact. And so I'm just trying to get a sense. And I think that business owners, they certainly appreciate the reimbursement program that we've made available to them. The minister has spoken at great length about the potential for some businesses, those that currently do not have a paid sick leave program, to make application for reimbursement. The concern, I think, by many businesses is that at this point in time, there's no eligibility criteria that is finite that businesses can look to, so they're incurring costs potentially today, right since the 20th of May, which I believe is the date that this particular legislation received royal assent. So these businesses are incurring costs today. Some businesses may be eligible for reimbursement, some may not. The magnitude of the total cost of the program is apparently based on, one, a rough calculation of 50% of workers in the province, whether that's 52, 48, a different number, I don't know. The minister is the one who's provided the 50% threshold that's been utilized. The 60% number that is also being referenced, which is the number by which the minister believes the participation rate in this program will be, we have not seen any detail on how that number was derived. So through you, Mr. Chair, to the minister, can the minister just provide some semblance of explanation on why the number of 60% was chosen? Was there a range? And I certainly don't want to assume anything. You know, the individuals that were charged with doing an estimation, hypothetically, may have been from 50 to 70 and they chose 60. But it was possibly something else. Through you, Mr. Chair, to the minister, can the minister provide some kind of sense of how the 60% utilization rate was actually determined?
Minister.
Thank you, Honourable Chair. Look, I'm not going to second guess my very capable staff and the ministry. They probably have looked at all kind of scenarios, but they went to the high end, the worst case scenario. They looked at different numbers being used. BC Federation of Labor is one, and there's another private organization. Whoever else may say how many workers out there have who don't have the sick leave provisions, looking at those realistic numbers, and then using a worst case scenario, 60%. That is pretty high, and that's how they calculated, at $200 per day. So I'm quite confident that they picked the right numbers, made the right assumptions, and therefore the cost of the program. And I am quite confident the way our vaccination program is, as I said earlier, the utilization will be lower than what they expected, what their assumptions are, and I think we will be well within this budget.
Member.
Thank you, Mr. Chair. Well, as a bit of follow-up to that, I think that what I'm trying to understand and obtain a sense of from the minister is how the 60% number was arrived at. Maybe I'll start this way, through you, Mr. Chair, to the minister. When the minister was provided with the cost calculations and estimation that actually arrived at the potential $320 million cost, I'm assuming, certainly don't want to put words in the minister's mouth, but I'm assuming that he would have a great deal of concern about the accuracy and the amount of prudence that was put into that calculation. As we've been discussing here today, the minister has continued to, reassure members that are listening and myself that he has a high degree of confidence. And I certainly don't, I'm not in any way trying to state that I don't have a high degree of confidence in the staff. What I'm trying to understand is how the 60% number was arrived at. In the minister's previous answer, he referenced the BC Federation of Labor. And so, possibly if the minister can expand on that, was the BC Federation of Labor asked to provide a percentage of utilization of their existing programs, and was that formulated into the calculation? But I think more importantly, through you, Mr. Chair, to the minister, can the minister share or advise this House if he asked for a fulsome briefing and to have ministry staff walk him through the calculation so that he actually was able to understand and have a good understanding of the calculation, and is that what the minister is relying upon when he indicates that he has a high degree of confidence?
Minister.
Thank you, Honourable Chair. The reference to BC Federation of Labor, it was their estimate of how many workers do not have sick leave provisions currently, not the utilization. I've never seen any numbers coming from BC Federation of Labor for the utilization. And but the 60% numbers that are given to me, by the staff, and of course we get all kind of briefing. I ask all kind of questions, and I was satisfied at the end of the day that 60% utilization was the worst case scenario in my view, and the cost to incur. For that kind of utilization, for all workers to utilize all 3 days, is reasonable, and I'm confident that prudence was put in place when they came up with the assumption, when they came up with the cost, and the $200 that we all decided that should be the reasonable amount for reimbursement for employers. And I think it's a program overall in totality I consider is the right program. In totality, I understand the good prudence was put in place when it comes to assumption and the cost, and also that I'm quite confident it'll be within that budget. And those are the questions, that's the discussion takes place when I talk to my staff, and I'm confident those numbers are reliable.
Member.
Thank you, Mr. Chair. Through you to the Minister. The Minister references that the 60% number reflected a worst-case scenario. Can the Minister share with us if he was provided with a best or probable case scenario?
Minister.
Honourable Speaker, thank you. The best case scenario is 0. And the worst case scenario they looked at was 60%. And so I'm confident that 60%, we are going to the high end to ensure that we are confident that we would be covered as far as the cost is concerned if all 60% utilize the entire amount that they're entitled to. I think those numbers, that's why I say that those are reliable.
Member.
Thank you, Mr. Chair. Through you to the Minister, is part of the reason why the Minister has such a high degree of confidence that it will not be higher than 60%? Is part of the reason for that because clearly just through the eligibility requirement, the Minister has the ability of precluding many workers that currently do not have coverage of paid sick leave by just precluding them altogether from even being eligible for the reimbursement program?
Minister.
Mr. Speaker, look, we have canvassed this, I don't know how many times and how many different angles. We have said this: those employers who do not have sick leave provisions currently, they would be entitled to reimbursement program up to $200 per worker per day. And based on, the average wage, $25 an hour. And that's how these numbers came up. And from the numbers that we rely on, that the million people don't have the sick leave provisions, and if 60% of them, that's a pretty high number, 60% of them utilize all 3 days, the cost will be $320 million. So that's why I'm very confident, and I think those numbers are reliable.
Member.
Thank you, Mr. Chair. Well, it seems apparent that the Minister has a responsibility of ensuring that the program is not subscribed in excess of the $320 million. And I think that's probably understandable. I don't know that anybody wants to necessarily be over budget with a program, and so the Minister has indicated he has a high degree of confidence. But in developing the eligibility criteria, which the Minister has indicated is fully within his purview, this is not direction coming from the Minister of Finance. This is not direction from WorkSafe BC. The Minister has indicated that he and his ministry alone, obviously in consultation with WorkSafe BC, but this is the Minister who has responsibility for oversight of WorkSafe BC as well, that the Minister has the pen. He has the ability to determine the eligibility requirement. The Minister has indicated that his estimates were based on 1 million workers that currently do not have access to paid sick leave. Well, the Minister has already, through his own admission, indicated that for any employers that have any form of paid sick leave program, even if 70% of their workers currently do not have access to a program, and those 70% that don't have access to a program would be part of that $1 million figure, the Minister is precluding all of those workers or the employers that work for that, or the employers that employ those individuals, precluding them from even having access to even make application. So through you, Mr. Chair, to the Minister, does he have such a high degree of confidence that the program will not have more than 60% utilization? Is that largely based on the fact that the Minister, just through developing the eligibility criteria, is precluding many employers from even making application for reimbursement under this program?
Minister.
Mr. Speaker, the answer is in a large shell no. We worked the other way around. We looked at how many employees out there, how many employers out there who do not have sick leave provisions right now. And that we say 3 days they would be entitled to a part of the program. And up to $200 would be reimbursement. That's how we came up with the cost. Not the other way around to see how many people we should be making eligible and how many shouldn't be. And then we say, okay, we've got to stay within this amount. We looked at what's out there. how many employees do not enjoy sick leave provisions right now. And in order to stop the pandemic, I want to come back to that, stop the pandemic to help the employer, help our society, help those workers to stop the transmission and start the recovery, economic recovery once again, and that we need to have this program. Employers demanded that, workers demanded that. And the medical community said long ago that we should have this program. But we looked at how many employers are out there that don't have sick leave provisions. Based on that, how many employees? Based on that, how many of them would utilize it? They came up with 60%, high end. And look at $200 per day for 3 days, maximum. That there will be, the cost will be $320. That's how we came up with it, not the other way around. How do we exclude so that we stay within this amount?
Member.
Thank you, Mr. Chair. So the minister has confirmed that the million workers that do not have access to paid sick leave, that it was that million workers that were utilized as part of the calculation to come up with $320 million cost estimate of this program. But the minister has also indicated through the eligibility criteria which he has created that a significant number of employers employing part-time and seasonal employees are not even eligible for making application for funds. So through you, Mr. Chair, to the minister, can the minister advise how many employees how many employees will it be ineligible for the employers to make application for reimbursement? I know that's a bit of a mouthful. So there's obviously a considerable number of employees that are working part-time or seasonally for corporations that only provide paid leave sick provisions for their full-time staff. Can the minister share with this House what his estimate is for the number of part-time and seasonal employees that will have access to paid sick leave from their employees, from their employer, yet the employers will be ineligible for even making an application? So if we've got 1 million workers in the province, there's a subset of those employees that will be provided paid sick leave from their employers, but there's also a considerable number of those that will be the employers will be ineligible for actually making application for reimbursement. Does the minister know what that estimated number is in the province, if at all?
Minister.
Honourable Chair, thank you. When the experts, the people in the ministry, when they looked at this program, I assume that they looked at all of those scenarios. How many workers will be utilizing this program fully? And they came up with 600,000 workers will be utilizing it. If they utilize it, all 3 days, the cost is $320 million. I mean, that's how they came up with 600 workers, part-time, full-time, all of them considered. And because they're pool of a workers group that do not enjoy sick leave provisions right now. So out of the million workers who do not, 600 workers, whether they're part-time, whether they're full-time, that the utilization out of that would be, they consider if 60% utilize them all 3 days at $200, that's the cost. And so I think, again, it could be a lot less because, the vaccination programs, and also it may not be 60% all of them because our vaccination program is so successful, and the COVID-related illnesses may not be there as they used to be weeks ago and months ago. So I think I'm quite confident that they looked at all those numbers, all different scenarios, went to the worst case scenario and came up with those numbers, and I'm confident that we will stay within that budget.
Member?
Thank you, Mr. Chair. Well, that varies from the definition or explanation that the minister provided during committee stage. And I don't have access to Hansard right now, but I certainly will go back to it. But it was my understanding, as the way the minister explained it during committee stage in the estimates process, that there was a full 1 million workers in the province who would have access to the paid leave provisions under this bill, and that the employers would be eligible for reimbursement, and that the 60% utilization rate did not refer to only 60% of the 1 million workers, or 600,000 being even eligible for reimbursement under this program, but it was that of all of the 1 million workers that were eligible, that the utilization or the subscription rate would only be 60%. And I believe the minister has even indicated that, not everybody's going to use the full 3 days necessarily. And so it's a bit of a different response when the minister indicates that there's potentially only 600,000 workers of the 1 million that are even eligible for reimbursement under this program. So it is a bit of a nuance, and but through you, Mr. Chair, to the minister, can the minister just, I guess, clarify, will 1 million workers, or the employers of those 1 million workers, be eligible for reimbursement under this program? Yes or no?
Minister?
Mr. Speaker, let me clarify that again. The estimates and the assumptions are that there are about 1 million workers employed by a number of employers who do not have sick leave provisions now. They are eligible. If they do not have sick leave provisions now, then those employers are eligible for reimbursement. And there are about 1 million workers who do not have sick leave provisions. Out of the 1 million, it is assumed that 600,000 may utilize, or up to 600,000. The high end, so this the utilization rate is being looked at. Our ministry felt that let's go to 60%. If out of the 1 million, 60% utilize all 3 days, then the cost would be 320. I hope that is clear, because that's what I said before, that's what I'm saying now. And to explain it any different way isn't correct.
Member?
Thank you, Mr. Chair, and I think I'll be moving on to another vein of questioning, but I think it is important. There's a significant number of employees that are part-time or seasonal that are eligible for pay under the legislation, but their employers are not eligible for reimbursement. So under the provisions of Bill 13, and the minister has referenced in many of his comments that it's has been referencing COVID-related illness. And the minister, I certainly welcome the minister to share with me otherwise, but the legislation which provides the amendment to the Employment Standards Act does not reference COVID. If an individual is ill, they're entitled to reimbursement. They're entitled to pay under the provisions of this Act. Sick, cold, otherwise, the minister, in his previous comments, had indicated it's largely a fairly low bar. There's not an ability for the employers to ask for a doctor's note. It could be something as simple as a spouse of an employee just saying, look, my husband was up all night coughing, he was ill, and he can't make it into work, and that's sufficient in order to entitle that employee to paid sick leave under this bill. However, the minister has also indicated in his commentary about the eligibility for reimbursement and has referenced COVID a significant number of times. So through you, Mr. Chair, to the minister, as the minister is looking to develop the eligibility criteria, can the minister share with this House or provide any confidence or certainty that an employee that is eligible for paid leave due to illness under this legislation will automatically be eligible for an employer to seek reimbursement that there's no other nuance with respect to COVID or a COVID-related injury that would apply, so that employers know that if an employee calls in sick and they're eligible for paid leave under the provisions of this bill, that they would then be entitled to reimbursement under this new program.
Minister.
Thank you, Honorable Chair. Let me remind the member, this part of the sick leave provision in the bill, it's called paid COVID-19 sick leave. And these are the criterias that must be met. Employees in the following circumstances are eligible for up to 3 days of paid sick leave from the date of the royal assent until December 31st, 2021. 1, they have been diagnosed with COVID-19 and are acting on the instructions or order of the medical health officer or the advice of a medical practitioner, nurse practitioner, or registered nurse. 2, they are in quarantine or self-isolation in accordance with an order made by the provincial health officer or under the Federal Quarantine Act, or in accordance with guidelines from the BC Centre for Disease Control or the Public Health Agency of Canada, or they have been directed by their employer to stay home because concerns about an exposure risk to others. And I believe I can confirm that I believe that there is a provision in the Act that require that the employer can ask for sufficient and reasonable proof.
Member.
Thank you, Mr. Chair. Thank you, Minister, for that additional clarification. Well, when I look at the actual amendment to the Employment Standards Act, it includes the reference to illness or injury. Okay. Thank you, Mr. Chair. The Minister just provided a bit of clarity for me. So just so I'm clear that the paid sick leave provision for employees has to be tied to a COVID-related illness. All right. And that the eligibility criteria for reimbursement from employers will align directly with the amendment to the Employment Standards Act. Okay, great. Thank you very much. Sorry, for those watching at home, the Minister was giving me some head nods and some reassurance that that is the case. Through you, Mr. Chair, to the Minister, the Minister has indicated that the applications or opportunity for employers to make application for reimbursement may be available as early as May 15th. Through you, Mr. Chair, to the Minister, can the Minister share with us, is there an end date, like is there an absolute certainty that it will be no later than the 22nd of June or the 1st of July? I know the Minister has a high degree of confidence that it will be available by June 15th, but just wondering if the Minister might be able to just provide a bit more assurance on when that program will be available, and if June 15th is a best case or realistic case, what would be the worst case that the Minister would accept for the applications to be open?
Minister, sorry.
Thank you, Honorable Chair. Look, we've been advised through my ministry from the WorkSafe BC that they're well on their way to have this program in place by June 15. It could be a few days earlier, it could be 2-3 days later, but that's the target date that they have right now.
Member.
Thank you for that, Minister. Through you, Mr. Chair, to the Minister, can the Minister share with us what he believes or what is the anticipated goal? So if a business makes an application on June 15th, what would be the time frame by which a business could anticipate actually receiving either a reimbursement check, or would it be a wire transfer? If the Minister just provide a bit of clarification on whether it be a check form that would be actually submitted back for reimbursement, whether it be an automatic payment or an option of the two, and what would be the goal or the optimum timeline that the Ministry or the WorkSafe BC would be working towards?
Minister.
Thank you, Honorable Chair. Yeah, I think it's an online program, and that's why we utilize WorkSafe BC, because they have a system in place and they have connections with these employers. So they will make a claim online and they will be communicated online. I'm advised that the estimation is within 2 weeks, but it could be sooner. But they have confidence that they could do it sooner than that.
Member.
Great. That is definitely good news. So thanks to the Minister for that response. Through you, Mr. Chair, to the Minister had indicated previously that approximately 90% of BC businesses are already registered with WorkSafe BC, which means that approximately 10% are not registered. So through Mr. Chair, to the Minister, can the Minister just share with us what the process would be for a business that currently doesn't have an account with WorkSafe BC, what process they would have to undertake or go through in order to, I guess, register for this program through WorkSafe BC, so that they would be then eligible to make a claim for reimbursement?
Minister.
Thank you, Honorable Chair. So I think we need to understand the 90% number or thereabout is all employers who have employee and they require WCB protection. and so they're registered. But if some employer, for some reason, wasn't registered, whatever reasons, I don't know why would that be, that they could register online, and then they can get on the line to be part of the system.
Member?
Thank you for that response. Through you, Mr. Chair, to the minister. So just so I'm clear, that a business that is not currently registered with WorkSafe BC would have to register with WorkSafe BC in order to be eligible for the reimbursement program. And I see the minister nodding his head, so I do appreciate that. The reimbursement program, the minister's indicated it'll be up and running by June 15th. There's a high expectation that reimbursement payments would be out within 2 weeks, and I think that certainly will be comforting to many business owners. With respect to the work that'll be undertaken by WorkSafe BC to, I guess, not just receive, but I'm assuming adjudicate or to verify the numbers in the application, is the minister able to share with us at this point in time what process will be undertaken within the ministry office, how much time would be involved, how many additional staff hours are anticipated, and if the ministry or if WorkSafe BC has adequate and sufficient resources to ensure that we do not see extended time periods by which those reimbursement applications would actually be processed.
Minister?
Thank you, Honorable Chair. So WorkSafe will not be utilizing their existing resources as far as the premiums from the employers are concerned. So that is for that purpose, and that will continue on that side. This program will be totally separate from their existing, because the existing program will continue based on the premiums that they're collecting and providing the service what they've been doing. This will be funded through separately, and all the resources that they need. The only thing that they will be utilizing is their connection to the employer, and they have that system in place. They have our data, and they will be utilizing it, so it will be easy transition. It will be seamless as can be, and so they will have resources in place to ensure that what they are telling us, that their turnaround time would be within what I said earlier, and also that they will have a system in place where the employer is online applying, and they're communicated. And if the Department of WorkSafe BC, based on the criteria that is being developed right now, needed additional information, they will be easy to ask, can you provide this? And then the reimbursement will take place.
Member?
Thank you, Mr. Chair. It's good to hear that resources will not be pulled away from WorkSafe BC for the reimbursement program. The minister previously, I believe in committee stage a few weeks ago, would indicate the estimated administrative cost of administering this program is about $1.4 million. Is the minister able to share with this House how many FTEs or full-time equivalents, or if this is a contract service, and if those employees have all been put in place, if there's more employees yet to be hired, if the minister could just provide a bit of sense of where they're at with respect to ramping up the administration for this new division which will be, I'm assuming, adjudicating claims that will be coming in from employers.
Minister.
Honorable Chair, thank you very much. I think a lot of these questions that we have canvassed here, the easiest and expedient way of doing it would be to bring back and reread the answered, because a lot of these questions were asked to Mr. Honorable Chair during the committee stage. But in this particular case, $1.4 million, as we canvassed during the committee stage, that's what the Works at BC estimated what their cost would be, and so that's what would be provided to them, and then we are leaving it up to them to ramp up or hire whatever they need to do, but they have a current system. They know exactly what they need in order to deliver by a certain time and what the turnaround time should be, what they need. So I'm going to leave it in their capable hands. We provide them already, as the member has suggested, $1.4 million, because that's what they told us, that's what the cost is going to be. So I will leave it with them, and I'm confident that they are moving forward, and as that's why I'm giving the dates here by what time the program should be up and running. And also the turnaround time. So I think based on what the Works at BC will do with that $1.4 million is how we deliver this program.
Member.
Thank you, Mr. Chair. Well, through you to the minister, I did canvass back in committee stage debate the potential administrative cost of $1.4 million, but I didn't receive any clarity with respect to how the function of the office and the number of staffing. The minister in his previous answer had indicated that existing WorkSafe BC staff would not be utilized for this program, and so I think it's a fair and appropriate question. Of the $1.4 million that has been provided to WorkSafe BC, can the minister share with us how many additional staff have been onboarded specifically to address the administration of this particular program?
Minister.
Thank you, Honorable Chair. Look, I think I don't want to, split hairs here. What is being said? The Works at BC, when I said, their resources will not be utilized, means like I try to clarify that the premiums that come in and they utilize for program to run their program that they run today. When the member said well, their staff will not be utilized, I think we need to be careful because the leadership is there. The leadership is working on this program. They are the one who will be directing, who are working with us. So, we got to be careful that some staff, at that level, is available because we are talking to them. They're existing staff there, so they are the one who would be guiding, showing, providing leadership to, put this program together. So, I just want to clarify that on one point. But the program is still being developed. They are developing it. I don't have the numbers, how many exactly employees they have hired so far. But I'm confident. They said, in order to run this program for us, it'll cost them $1.4 million. So there will be they're the one who are responsible for it. So I expect that they will have all the pieces together to run this program so that we have this program up and running by June 15 or thereabout, and so that they have sufficient resources to have the turnaround also as the prescribed time that I've mentioned.
Member?
Okay, thank you very much for that clarification. So existing WorkSafe BC staff largely will be utilized for providing a lot of the administrative services for this program. But as the minister has clarified, there would be no financial burden put on existing WorkSafe BC premiums to provide those staff. Fair enough. So through you, Mr. Chair, to the minister, the minister has indicated that he's not familiar with how many additional new staff have been brought on to administer it. The reason I'm asking the question is that I think that there's a significant degree of concern that as businesses are starting to incur these additional costs, that they want to have certainty that when they make their applications for reimbursement, that those reimbursement applications are processed in a timely fashion. As the minister indicated, that's largely within a couple of weeks, I think, is the goal or the objective, which I think most employers would agree with. Having said that, I think it's also important that we have a good understanding of the additional resources that have been brought in WorkSafe BC in order to make sure that we have a successful launch in this program and that we don't end up with the potential concern where businesses are waiting unnecessarily for their reimbursement claims to actually be processed. So through you, Mr. Chair, to the minister, can the minister, I'm assuming that he has WorkSafe BC staff on the phone, or is he able to make an inquiry with them to determine how many additional FTEs have come on board within the last 2 weeks that I believe that this program has been under development, just to provide some certainty that there will be sufficient staff levels there to ensure that employers are going to receive prompt and timely reimbursement of their claims.
Minister?
Honorable Chair, thank you. So I think, when the WCB advised us that they will have the program up and running by about June 15th, that is good enough for me. I'm not going to ask them who's going to manage which desk and who will be doing what job in order for somebody to satisfy, well, actually work is getting done or going to get done. And also that they will be they will provide us assurance that the turnaround time will be timely fashion. They told us about 2 weeks, and I think that is good enough for those who are listening and those who will be utilizing this program. So I think that should be enough, and they told us what the total cost would be, $1.4 million, which means that they have determined how many FTEs they need, or what time and when, and who will be doing what and what expertise they need out of those staff members. They will be making those decisions. So I leave it up to them, and all I need is to make sure when the program is going to be up and running and what the turnaround time, because I am concerned that the employer who are already hurting, they need that quick turnaround, because they will be paying up front. Then many of them have cash flow problems. There's no doubt, and I understand that. That's why we are utilizing WorkSafe BC rather than establishing a brand new program. You know what happened when you establish a brand new program to run $320 million through the program, the IT, the other infrastructure, and there are always glitches, the delays. But in this case, I'm confident. That's why we went to WCB, and I'm thankful that they said yes to it, and that they will be delivering this program. But $1.4 million, they told us, is sufficient for them to have enough staff, resources, infrastructure to put in place so that they could deliver within those timeframes.
Okay, members, we will now take a 5-minute recess while we undertake cleaning Okay, 5 to 10 minute recess while we undertake cleaning and safety protocols in preparation for a new committee chair.
Members, we'll now call the committee, I now call the committee back to order. Thank you, members, for your patience and continuing debate. I recognize the member from Shuswap.
Thank you, Madam Chair, and welcome. So at this juncture, I think you're going to move back over to just some further questions on WorkSafe BC. And so the first question that I had through Madam Chair to the Minister is that can the Minister, sorry, let's see. Yesterday we had canvassed a number of questions with respect to Bill 23. And at that particular time, the Minister had indicated that not all of the recommendations of the PAR report were acted upon, and gave some reference to some specific clauses of the PAR report that were acted on. Through Madam Chair to the Minister, I'm just wondering if the Minister has had a chance to actually provide the detailed cost estimate on the different numbers that arrived at the 1.4 cent increase per $100 of payroll that we had spoken about yesterday.
Minister.
Thank you, Honorable Chair. So there were two areas of significant cost to the PAR report that we adopted and made part of Bill 23. One was moving from $87,000 to $100,000 maximum earnings. That cost would be about $10 million. And loss of earning versus loss of function, that cost would be $4.5 million. And those two, I'm advised, translate to 1.4 cents per $100.
Member.
Thank you, Madam Chair, and thanks to the Minister for providing that further clarity with respect to those two different provisions that were undertaken. Through you, Madam Chair, to the Minister, there was a number of other recommendations that were costed in part of the PAR report, including Section 4, search and seizure powers, Section 17, restoring the dual pension system, Section 20, changing maximum insurable earnings, and Section 18, retirement age adjustment. Just wonder if the Minister could just provide some clarification which of any of those additional recommendations are being acted on or anticipated to be acted upon.
Minister.
Thank you, Honorable Chair. So those are the two items that I mentioned had significant cost to it, but there were a number of others. Seize and search authority, victim impact statement, to pursue charges that now you do not need a CEO's approval. Retirement date, when do you determine that? And pre-claim acceptance part is what I'm advised could be some saving there. So all of the others that I mentioned are negligible based on the information that they have. The retirement age, it's hard to come up with cost to it because you don't know. Right now, the way it is that if you are permanently disabled at age 25, you're determined to be retiring at age 65. And but it is moved to age 63. So now these people who are in the process, who would be who may become permanently disabled, now what that means is that they will be given the opportunity to determine their retirement age at age 63. So it was hard to come up with the real data and the real cost, but that will be calculated, I'm sure, as they move forward. But those are overall, that was the cost with the information that we had at that particular time.
Member.
Thank you, Madam Chair, and through you to the Minister. Well, the PAR report, Section 4, which is established on page 12, it estimated a cost per $100 of payroll at 0.2 cents. Section 17, restoring of the dual pension system, on page 36, it identified a potential cost of 0.4 cents. Section 20, changing the maximum insurable earnings, as identified on page 15, estimated a cost of 2 cents. In Section 18, which is the retirement age adjustment, and it does reference in this report, well, no costs were associated with changing the age of determination. There were costs associated with changing the references from 65 to 70 and 63 to 68 in the Act. And that was estimated at 5 cents. So a significant cost. Just through you, Madam Chair, to the Minister, can the Minister explain what undertakings of the WorkSafe BC were undertaken to determine that there was negligible cost when the PAR report specifically suggests something quite different?
Minister.
Thank you, Madam Chair. So that's a good example that PAR recommended a number of things, and we only picked up some of it and parts of them. For that particular case, he recommended move the retirement age to 70. We didn't go there. We simply say that age now will be determined not at the time your permanent disability, but closer to your real retirement, which is close to 65. So they recommended that it should be close to 63. So that's why that cost is not there. It will be determined as they see, because there still could be no change. But whatever the retirement age right now, there isn't. How should I put this? A hard and fast rule that everyone is retiring at age 65. There are chances, there are exceptions. People are being paid till age 80, 75, 70, 85, some of them. So I think it still will be determined if that part changes. like where the majority of the workers will be retiring, whether that part will change. Because I think all it meant was that when you're closer to retirement age, that's the right time for them to determine what your real retirement age should be or would be based on individual circumstances. It may be better and maybe a saving. I don't know that, but it could be different than what we have today. So that's why they couldn't pinpoint the exact cost. So we didn't go to age 70. And there are a couple other recommendations. For example, tying the disability to CPI, and also providing lump sum to those injured workers. We didn't go there. So those were very, very costly items, and that's why the cost that is determined by PAR report for those recommendations, had we gone all that? Yes, but we didn't. But the cost that we that they calculated on what we actually put in Bill 23 was based on the information what we have, as I provided, that 1.4 cents per 100.
Member.
Thank you, Madam Chair. So just as a bit of a follow-up to that, through you, Madam Chair, to the minister, the minister indicated that the adjustment of earnings from 87K to 100,000 a year in earnings was estimated at 10 million, or 1 cent per $100 of payroll. The PAR report identified that changing the maximum insurable earnings was 2 cents, so twice as much. Just wondering through you, Madam Chair, to the minister, can the minister explain, was there a different maximum insurable earning that was utilized in the calculation, or why is the minister's number roughly half of that was estimated in the PAR report?
Minister.
Thank you, Madam Chair. Perhaps where there may be an adjustment, when we were developing Bill 23 and we consulted with the WCB and looked at the real cost of each of those items, it is the $10 million is a net because when you raise the insurable earnings maximum from 87 to 100,000, it means more revenue now is coming to the board. So I think when you have that additional revenue offset by the real cost, then we were advised that the real cost is $10 million, and so that's why I'm giving that number, and that's how we determine the cost to Bill 23 as what I gave.
Member.
Thank you, Madam Chair, and thank you to the Minister for that clarification. So the PAR report was correct in estimating that the cost of the program was potentially 2 cents, but what the PAR report did not take into consideration is that the elevation of the payroll cost also provides an offsetting increase in revenue, so the net cost is the 1 cent. Okay, so thank you very much for that clarity. That seems to make sense. I certainly appreciate that additional clarity from the Minister. One of the other provisions of Bill 23, it paved the way for presumptive coverage for COVID-19. Through you, Madam Chair, to the Minister, can the Minister just clarify, did that presumptive coverage take effect, or what date did it actually take effect? And if the Minister has any indication or any stats that he can provide as far as the number of claims that have been processed that have taken advantage of the presumptive COVID-19 clause, and what the costs associated with those claims may have been to date, or to whatever the most recent date is. The Minister may have numbers.
Minister.
Thank you, Madam Chair. So Bill 23 and that particular clause that the member asked for came into effect August 20th, 2020. And I've got, as of March 26, 2021, 4,391 COVID-19 illness-related claims have been registered with WorkSafe BC. And of those, 2,785 claims were allowed and 1,104 claims were disallowed. And the remaining claims are pending for testing or other information. This information is available on WCB website. It's public.
Member.
Thank you, Madam Chair. And does the Minister have any cost estimates for the costs of claims that have actually been incurred to date, or to the period of March 26, as the Minister has referenced?
Minister.
Thank you, Honorable Chair. So I'm advised it's too early to come up with the exact cost because some claims are still open. Others are still being investigated, I guess, because some of them were rejected and appeal system and all that stuff goes on. So sometime they will put all the costs together, and then I think we will know the numbers.
Member.
Thank you, Madam Chair. I believe the fiscal year end for Works APC, does it follow government's year end of March 31? So it would be a fiscal year end or calendar year end. Okay, thank you very much. So, Madam Chair, the minister's just confirmed that Works APC operates on a calendar year. So as of December 31st, I'm assuming that the ministry would have, or the Works APC would have had a full understanding of what the costs, expenditures would have been through from August 20th, when Bill 23 came into effect, through till the end of fiscal 2020. So through Madam Chair to the Minister, just hoping that the Minister might be able to provide or share some level of detail with respect to the costs that were incurred for claims from the period from March 26th through till the end of last year, just to give some kind of a sense of the potential cost that this provision is actually having on Works APC.
Minister.
Honorable Chair, I'm advised that they don't have that information at this particular time. I mean, again, understanding that August 20th, December 31st, it would be even more difficult at that time to determine the cost because the more claims would have been in the system at that time, so wouldn't been finalized. There will be few finalized, perhaps, but not all of them. So I think once they have that information, I'm told that we could provide that information.
Member.
Thank you very much. I fully appreciate that a claim that may have only been advanced in September or October, it may not have been fully concluded, and so there will be the inability to determine what the full cost of that claim is because it's still in process. But I would assume that the ministry would have a cost code associated with COVID-related claims, and as at December 31st, 2020, there would be a number of expenditures that would have been assigned to that classification. So through Madam Chair to the Minister, just wondering if the Minister can clarify what expenditures were actually undertaken by Works APC as of December 31st of last year. And I appreciate that that will not line up necessarily with the 4,300 claims, of which I think the Minister indicated that 2,785 were allowed, but that was at March 26th. So just trying to get some kind of a sense of what the costs that might have been borne by the extended provision of the presumptive clause for COVID-19. And then further to that, through you, Madam Chair, to the Minister, if the Minister could share if there was any cost estimates that were undertaken or determined at the time that they extended the presumptive clause for COVID-19 and what the potential impact that may have been on future premiums. As identified in the PAR report, there was some pretty significant cost estimations that were done for any changes within the legislation on what the impact to employers might be, and I just wonder if the Minister could share if this similar rigor was put behind trying to identify even a hypothetical cost that the presumptive coverage of COVID may have with respect to the costs that employers pay for premiums for Works APC. much cooler in here than it was just before we broke for recess.
That's good.
Yeah, once they turned it on, yeah, because I was hearing that the ventilation was better in the building. And I was wondering where that was. Minister.
Thank you, Honorable Chair. So the member should know that the COVID was COVID, work-related COVID was considered to be compensable injuries or illness. Okay, so prior to this clause came into effect, I'm advised that 92% of the claims that came as a result of COVID illness, work-related COVID illness, were accepted. And with these provisions, it made it a little easier, and it went to 95%. So they don't have the exact cost because many claims were still going through the system as of end of December 31st. And but again, if that gives you any indication, it's not significant high numbers compared to prior to having the presumptive clause in place. So I think I hope that gives a member some comfort.
Member.
Thank you, Madam Chair. Okay, so thank you to the minister for that additional clarity. Is the minister able to share what the total costs were for fiscal 2020 as related to COVID-19 claims?
Minister.
Madam Speaker, no, I think I gave that answer. They said they don't have that information available to them at this time, but we can provide that at a later date when they have that information.
Member.
Thank you very much, Madam Chair. I certainly would appreciate that. I'm still having a bit of a hard time understanding. There were COVID-related claims that were processed during fiscal 2020. At the year end, there would have been I'm assuming a classification that would have captured all of the costs that were incurred within WorkSafe BC for fiscal 2020 related to COVID. I appreciate the nuance that the minister has been able to provide additional clarity that the acceptance rate only changed by about 3% from 92% to 95% as it relates to Bill 23. But overall, I'm just trying to get a sense of how much COVID-related claims have actually cost WorkSafe BC in the last year. And so if the minister has indicated WorkSafe BC doesn't have that number available now, through you, Madam Chair, can the minister provide or advise when those numbers will be available? And again, we're talking about expenses that were incurred in the last fiscal costs prior to December 31st of last year.
Minister.
Thank you, Honorable Chair. I'm advised that they can provide that information to the member fairly quickly. I think maybe within a month.
Member.
Through you, Madam Chair, to the Minister, thank you very much for that. I certainly will appreciate, and I'm assuming that I won't have to ask for that a second time, that when it's provided to the Minister, you would just provide it to myself through email or something like that. Is that correct? Or do I need to follow up just for the Minister to provide some clarity for me?
Minister.
If the member doesn't get it, then just write email or letter, and then I'm sure you will get it then.
Member.
Okay, thank you very much, Madam Chair. I'm just going to shift gears just for a moment and go back to the Employment Standards Branch. Now, yesterday we did a significant amount of consultation and discussion around the backlog within the Employment Standards Branch. And the Minister yesterday had advised that the current backlog was 4,400 claims. Through you, Madam Chair, to the Minister, if the Minister could also provide what the backlog was for the years 2017, 18, and 19.
Minister.
Thank you, Honorable Chair. Honorable Chair, there has been a historic backlog at Employment Standards, despite the fact that there was a self-help kit. So we knew the backlog existed, but it wasn't seen. And soon we lifted the self-help kit when we brought in Temporary Foreign Worker Protection Act. It added to the backlog. So if I go back to 2018, and those timing are important, that when we got rid of the self-help kit and brought in the new programs in place. 2018, at the end of the year, was 909, and in 2007 it was about 508. And 2019, this is the time when we are eliminating self-help kit and bringing in new programs. At the same time, we added $14 million So we knew that it would add to the workload. So 2019 December, it was 2,916. And 2020, it went to 4,700.
Member.
Thank you very much, Madam Chair. I know that the minister will probably be disappointed to hear, but I've mostly concluded my time in estimates today. And so I do want to thank the minister and the staff for providing answers to us here today. Certainly, I appreciate the level of detail that the minister has provided. And this is an extremely important process for listeners watching from home. Government operates on about a $70 billion annual budget, a significant amount of expenditures, and this is the only opportunity through the estimates process really to ask specific questions of government. We uncovered some information that I certainly didn't know at the front end of the estimates process. I certainly have some concerns, but this will conclude my time in estimates today. So thank you, Minister, for your time, and to you, Madam Chair, for the opportunity to canvass these questions of the Minister of Labour.
Seeing no further questions, I ask the minister if they would like to make any closing remarks before I call the vote.
Thank you, Honourable Chair. I'd like to thank the critic and also the member from Green Party, the leader of the Green Party who participated in these estimates. I agree that this is a very important process. I enjoyed it when I was in opposition, and this was an opportunity where you could ask in-depth questions about how the ministry is run, how those programs are being operated, and the cost and the accountability, the transparency, all of that. And I want to thank the member for civility and the respectful dialogue that we were engaged in for the last couple of days, I think now. And I think I also like to offer the member, if the member like to have additional information that he wasn't able to ask those questions here, feel free to reach out to me, and I will try to do my best to give the information. Because at the end of the day, we are for people who are watching. We are the people who will be impacted by the decisions that we make here today as a government, and the opposition has an important role to play to hold us to account, to make sure that we are delivering on the expectations of the people who elected us and sent us here. And that's why it is so important for having an effective opposition and a government that operate. And we have made it very clear ever since we formed government, from the Premier down, under the Premier's leadership, that we want to put people first and then develop policies around, not the other way around. Because those are the people who elected us, those are the people who have expectations, they have concerns, they have issues. We want to make sure that their life is more affordable. We want to make sure that they all benefit from our sustainable economy. We want to make sure that the services that they can depend on are available at a time when they need them. Healthcare, education, transportation, WorkSafe, health and safety of the workers. I want to reiterate again and again and again that my goal is to make workplaces in British Columbia the safest in the country. Because the workers deserve that, and their families deserve that, and we owe it to them as a government who come up with the policies that guide their health and safety at workplaces. And when they are injured, if they become ill at work, that they are treated with respect and dignity when they are navigating their claims through WorkSafe BC. So I think we are trying to achieve those goals, and that's what the expectation is from our electorate. All the workers, the employers need to understand that the WorkSafe BC is in a sound financial position, that they are there to deliver services to the employers as well as the workers. So I think we are achieving that. I'm satisfied in the last 3.5, 4 years now that I had this responsibility. that those people who don't enjoy the benefit of the unions, that they have all those barriers to justice removed, and we are going to work our best to make sure that the backlog is removed in a timely fashion so that they get to the justice as soon as possible. We want to make sure that the workplace places are safer, and we want to make sure that the workers who have the constitutional right to join a union, and if they wish to join a union, that there is no interference by anybody. So I think those are the guiding principles that I work under, and I owe to the people who have elected us as government, and we want to make sure that we provide them according to the expectations, and that's what we're trying to do. So thank you very much to the critic, and those are my closing remarks.
Thank you, Minister, and all members. Seeing no further questions, I will now call the vote. Those participating remotely should prepare their voting cards. Those in favor, please indicate aye.
Aye.
Those opposed indicate nay. Motion carried. Thank you, members. Thank you, and the committee will now take a 5 to 10 minute recess while we prepare for, oh, wait a minute, I have one more thing to do. I beg your pardon. No, okay. No, that'll happen later, yeah. So we're going to take a recess, folks, while we prepare for the Ministry of Mental Health and Addictions. I call the Committee of Supply, Section A, back to order. We're meeting today to consider the budget estimates of the Ministry of Mental Health and Addictions. I would like to remind folks to turn on their videos. I now recognize the Minister to move the motion.
Thank you, Madam Chair. I move that a sum not exceeding $12,735,000 be granted to Her Majesty to defray the expenses of the Ministry of Mental Health and Addictions Ministry operations to 31st of March 2022.
Mister, do you have some opening remarks?
I do. Thank you, Madam Chair. I'm grateful to be on the traditional territory of the Algonquin-speaking people, the Songhees and Esquimalt First Nations. I'm joined today by Deputy Minister Christine Massey in person, and remotely Assistant Deputy Ministers Nick Grant, Daryl Sturdivant, and Ali Butler, along with Ministry's Chief Financial Officer, Dara Landry, and a few others. As British Columbia's second ever Minister of Mental Health and Addictions, I'm grateful to work alongside the many dedicated and passionate people who are working to build a comprehensive system of mental health and addictions care that work for everyone in our province. Today, literally, that is ministry staff. And I'm honored to work with a new ministry, just several years old, that works with new perspectives and new approaches. And as well, the OERC, our Overdose Emergency Response Center, which is embedded within our ministry, is doing vital work. Every day, our ministry's work is informed by the life-saving work of practitioners and peers on the front line of the overdose and mental health crisis, and I'm especially thankful for their service. I recognize also today, in particular, the 176 lives lost in the month of April to the toxic illicit drug supply, accidental overdoses. Those numbers reported today by the BC's chief coroner. I also recognize the national mourning that is happening with the discovery of 215 children found at the Kamloops residential school. The Tecumloops Sepmetwek people are mourning, but it's affecting the whole country. And so that is a reminder to me about the work we are doing in this particular atmosphere and environment. This year has been extraordinarily difficult for everyone. As a result, people are talking more openly about mental health and addictions challenges than ever before. Because COVID-19 had strained people in unprecedented ways, highlighting the need for increased access to evidence-based mental health and addiction services. I'm thankful that our government began building up the system of care before the pandemic hit, because we were able to lay some important foundations that made it possible to quickly respond to the tremendous challenges posed by simultaneous public health emergencies, the overdose crisis and COVID-19. Since 2017, we have made critical investments in key service areas as part of our ongoing work to build the comprehensive system of mental health and addictions care that British Columbians need and deserve. We have accomplished much, despite navigating two public health emergencies, each having an unfortunate effect on each other. We know there is much more to do, because people and communities are hurting now. Our job as a government is to chart the path forward, to aid a strong recovery, to leverage people's incredible resilience, and to give British Columbians a reason to feel optimistic again. Budget 2021 plays a big part in achieving these goals. It's a budget that promotes a resilient recovery. It's a budget that makes the largest ever investment in people's mental health and well-being in British Columbia's history. It's a turning point for our province. We've mapped out our plan, a pathway to hope. We've been progressing along the journey of building up a system of care, and now with this historic $500 million investment, building on the transformative investments made over the last 4 years, our journey is speeding up. Step by step, we are transforming mental health and addictions care in BC. Budget 2021 is not just a step, but a leap in the right direction. We know that the strength of a province depends on the health of its people, and the economy is only as healthy as the people who power it. Budget 2021's historic investment in mental health and substance use care will help us move forward from the pandemic stronger together. This budget makes targeted investments where help is needed most urgently. We know the pandemic has been devastating for children and youth. We know that early intervention is key to stopping small problems before they become big ones, and that getting young people on the path to good mental health benefits everyone today and tomorrow. And that is why we're investing $97 million in key services for children and youth. Our education system is being resourced to help people recover from this challenging time. For example, we recently announced $40 million for new integrated child and youth teams for 15 regions where support is needed the most. Foundry centers are being expanded to help people bounce back in the aftermath of the pandemic. We've just launched Foundry app to connect young people and their caregivers to vital support services no matter where they live. And we're doubling the number of substance use treatment beds for youth province-wide. Budget 2021 lays the groundwork for a strong recovery for youth after a very particularly difficult time, helping to set them up for good mental health practices for life. Likewise, we're working on behalf of British Columbians of every age to improve access to mental health services across the continuum of care. Budget 2021 comes at a crucial time as experts warn about the potential mental health crisis following the pandemic. We know 40% of Canadians say their mental health has deteriorated since the onset of COVID-19. And this budget amplifies the work that we have done over the past 4 years to build up BC's system of mental health care. New resources this year include $61 million to continue improving access and quality of mental health services, including expanding eating disorder care, better access to suicide prevention services, and early psychosis intervention. We are integrating mental health care into primary care through urgent and primary care centers and primary care networks, with 22 locations so far in BC, where people can access clinicians 365 days a year for same-day access funded through MSP. We're making significant investments in low and no-cost counseling services, $12.4 million, with more to come through Budget 2021, to ensure that people can get the help they need regardless of the size of their pocketbooks or where they live. New assertive community treatment teams are being added across BC to connect more people to care, 30 teams in total. We know there are gaps in the current system, especially for people with more complex needs, and we are committed to filling those gaps as we build the comprehensive system of care from the ground up. Step by step, mental health care is transforming in British Columbia. Pandemic has also led to a terrible surge of overdose deaths here in BC, across Canada, and in other jurisdictions too. Last year, more than 1,700 British Columbians lost their lives to an increasingly toxic illicit drug supply. People are dying in communities across the province, in urban and in rural settings. Tragically, most people dying at home alone. Often their family and friends had no idea that they were using illicit drugs because of the secrecy driven by stigma and shame. This overdose crisis has not arisen out of COVID, but it has worsened it, and we are seeing the collision of two public health emergencies. It's tragic, insidious, and incredibly difficult to get a handle on, but we are working around the clock, across the spectrum of addictions care to save lives. Budget 2021 invests $330 million to continue building the full spectrum of substance use treatment and recovery services, including expanded access to prescribed safe supply. Prior to the pandemic, overdose deaths were coming down for the first time in years, so we know what measures can work. We will continue expanding access to overdose prevention services. Overdose prevention sites we've doubled since 2017. Last year, nearly 3,000 overdoses were survived at safe consumption sites with 0 deaths recorded. And since 2016, more than 6,000 deaths have been avoided because of the interventions that we had implemented, like expanded access to naloxone. So we will continue expanding access to life-saving prescribed safe supply to separate people from the increasingly toxic illicit street drug supply. Following the lead of the Canadian Association of Police Chiefs, public health officers, and many advocates on the front line, we will continue pursuing decriminalization to reduce the stigma and shame around drug use that prevents people from accessing help. We're increasing the number of practitioners who can prescribe treatment medications, such as registered nurses, a never-before-done assignment in Canada. And Budget 2021 will add another 195 new treatment and recovery beds for adults, on top of the 100 adult beds that we've added last fiscal year, and the doubling of youth treatment beds, which is underway now. What this means is that people struggling with substance use are getting much more help in British Columbia than they ever have, and much more than they could in other provinces in the country. We're leading the way on our response to the overdose crisis. We know there is much more to do, but we are working hard to save lives in the process. In conclusion, British Columbians are emerging from an unprecedented time. Some people will come out relatively unscathed. Others will be coping with ongoing grief, trauma, illness, and loss. There has never been a more important time to prioritize mental health and substance use services. Now is the time to advance large-scale systemic change to an inadequate and outdated system of care. Budget 2021 is a giant leap forward on this front. We will build up what is working and create new solutions where needed. We will put people first every step of the way and listen to the advice of those with lived experience. We are on a journey of transforming BC's system of mental health and addictions care. With thanks to my opposition colleague, I look forward to your questions. Thank you, Madam Chair.
I now recognize the member for Surrey White Rock. Do you have any opening remarks?
Yes, I do. Thank you, Madam Chair, and thank you to the Minister and her staff. A couple of things that I do absolutely agree with the Minister on is that 176 deaths, what we talked about today in the month of April, is far too high, and one death is too high. And I think that this week and this day has been a very, very sobering for somebody new to this House, and new to some of the issues in front of it. I will say that the enormous gravity that we're dealing with when it comes to overdose deaths and mental health and mental illness is staggering, and it's something I think, whether or not you hold a critic file or you hold a minister's position, I think it's incumbent on all of us to do our part to ensure that we're moving in the right direction. And I do wholeheartedly think that the minister's intentions and the ministry's intentions are to get us to a better place, and we will fundamentally disagree on some things, I'm sure, but I do not question her passion for the file, and I don't think she would question mine. And I do believe that at the end of the day, mental health is the most important health that we have. I'm a father of 3, and I just got a text that when my son just got vaccinated. He's 12 years old, so I'm glad that got another one to go. So, so I do think that we're making progress, but the news, then the minister referenced it over the weekend, what we saw come out of Kamloops, and I do think that has absolutely shaken us all to the core, and I appreciate the minister's words on that, and I'll be use the rest of my time for questions, but I am looking forward to the conversation ahead.
Go ahead, member.
Introduced her staff. Is she able to, and I know that the minister's deputy minister resides in the Ministry of Mental Health and Addictions. For the other staff that the minister mentioned, can she just outline them again and then which ministry they report into?
Minister.
Welcome to the chair. Thank you to the member for the question. I really should have spelled these out. So I did introduce my deputy, Christine Massey, who's here in the room with us. Nick Grant, who I introduced as Assistant Deputy Minister. He is responsible for children, youth, mental health, and substance use. Daryl Sturtevant, you might not have had a chance to meet before, another Deputy Minister appointed this year. He is Assistant Deputy Minister responsible for adult substance use, and the Overdose Emergency Response Center falls within his rubric. And Ali Butler reports to Daryl. She was the acting ADM in that role until just a couple months ago. And I mentioned that Daryl Landry is our CFO, and they all report to the Deputy Minister of Mental Health and Addictions, who is here in the room beside me.
Member Surrey White Rock.
Thank you, and welcome to the chair. How many FTEs reside in the Ministry of Mental Health and Addictions?
Minister.
Thank you, Madam Chair. The ministry has a total of 83 staff, including the minister's office. All the positions are permanent. Yeah, that's.
Thank you, Minister. Member Surrey White Rock.
Thank you. It's I think the one thing I share in common with the minister. I think this is our first estimates. I don't know. Is it your first? It's my first estimates too. Your deputy minister who's seated with you today, does she report to the deputy premier or deputy minister in the premier's office?
Yes.
Thank you, Minister. Member. Oh, I forgot again.
That's okay.
Member Surrey White Rock.
Thank you so much. And just in terms of the budget for the Ministry of Mental Health and Addiction, so can the minister tell me what the current fiscal budget is for this year for just the Ministry of Mental Health and Addictions?
Minister.
Thank you, Chair. It is just under $13 million this year and for the next two.
Member.
Thank you, Chair. Can the minister tell me how much of that budget is dedicated to administration services? And sorry, to clarify whether that be staff salaries, just admin in general.
Minister?
Thank you, Chair. So close to 70% of the budget is allocated to salaries and benefits. The remainder to other operating costs, professional services, travel, information technology. Thank you.
Member?
So would the minister agree that out of the budget that she just cited a couple minutes previous, that there is no funding that comes out of this minister's particular budget that is for services to deal with mental health and addictions?
Minister?
Thank you, Chair. So none of the budget is for ongoing mental health and addictions programs and services. Those budgets are held by other ministries, as I think has been well described in question period and other places. We do at times issue one-time grants to community organizations to provide services that are aligned with the pathway to hope. Thank you.
Thank you, Minister. Member?
Thank you, Chair. So would the minister agree that the budgets that we are canvassing today with her particular budget, if almost 100% is directly to admin and other services and pretty much nothing is going out for services, whether to do with mental health and addictions, does the minister find that is acceptable, given that other ministers are accountable for fulfilling services related to mental health and addictions?
Minister.
Thank you, Chair. So as I said in the previous answer, there are services included in our budget that are delivered to community organizations and frontline groups that are one-time or sometimes three-year funding, but not core program funding. And I think has been well described so far as the aim of our government in establishing a separate ministry is not to be a service delivery arm for mental health and addiction services, because we don't want to separate care of the mind from other parts of the healthcare system or education. And so I'm going to describe some of the other ministries that are the delivery arm for mental health and addiction services. The Ministry of Health remains responsible for overseeing addiction services for people of all ages and mental health services for adults through the health authorities and their funded agencies. And it is responsible for implementation of the strategic direction provided by the Ministry of Mental Health and Addictions. Each health authority is responsible for its operational planning and delivering the full range of health services in the region. Government has given health authorities the flexibility and mandate to make decisions about how to deliver all forms of health care. The Ministry of Children and Family Development provides mental health services for children and youth across the province. The Ministry of Mental Health and Addictions works closely with Ministries of Health and Children and Family Development, and often education, depending again on the budget and the program, to monitor and evaluate the access and quality of mental health and substance use services to ensure people are receiving timely access to the services that they need. Thank you.
Thank you, Minister. Member?
Thank you, Chair. And I think when the Premier introduced the Ministry of Mental Health and Addictions, and I believe it was 2017, I think a number of us, myself included, applauded that because we understood the importance of the file of mental health and addictions, obviously. And I said from my beginning comments, and I heard the minister's authentic comments in what she believes in what we're facing with mental health and addictions and what we'll be facing in the future. The one thing, and I have said this publicly in question period and in the media, and the minister has responded, but I think it's good to put on the record here, is the idea of a Ministry of Mental Health and Addictions, I think, is very vital, and I think is very important. And I do understand that there's a title with Minister of Mental Health and Addictions supported by a Deputy Minister and equivalent ADMs and such. Can the minister outline for me what would separate her ministry in terms of a budget from that of a Ministry of State?
I only have one person. Minister.
Thank you, Chair. So my understanding is that ministers of state do not have responsibility in their own budget authority. So in this case, the budget responsibility is directly with me, and my mandate letter reflects the areas of responsibility that the Premier has asked me to take on. Thank you.
Member?
Thank you, Madam Chair. Would the minister agree that the majority of services and responsibility for the file of mental health and addictions resides underneath the Minister of Health?
Thank you, Chair. So it's our estimate that each year, in the order of $2.7 billion is spent under the British Columbia government budget on mental health and addiction services. That's clearly significantly larger than the ministry budget for mental health and addictions. That is spent 80% under the health budget delivered through health authorities and by health directly, Ministry of Children and Family Development, Minister of Education, and I'm quite sure some out of Public Safety and the Solicitor General's office as well. Thank you.
Thank you, Minister. Member?
Thank you, and thank you to the Minister for that. I'll go back to that in a second, but I just want to ask a comment. I did listen. I think the Minister made a speech to the Greater Vancouver Board of Trade. I believe it was in January. I don't have the exact date. And the Minister said the government plans to launch a Made in BC online educational platform and virtual training program to help employees manage stress and build resiliency. And she said, I believe the Minister said that would be done by the end of May. She said, stay tuned, more to come. I'm just wondering, we're past the end of May, and what is the update on that program that the Minister announced at the Greater Vancouver Board of Trade?
Minister?
Thank you, Chair. So the announcement that the member is referencing, we were aiming the end of March, actually, and my memory is that we launched March 31st, just to work hard to keep our commitment. And the label is the Workplace Mental Health Hub. This was built based on what had been built a year earlier to support the tremendous pressure that long-term care workers and frontline healthcare workers were under. That was the Care for Caregivers site, careforcaregivers.ca. It has had over 65,000 page views and has had very strong feedback. So based on that, positive feedback, March 31st, we launched the new Workplace Mental Health Hub. It provides workshops, webinars, information to support employers and employees, particularly those who work in tourism, hospitality, and community social services, 3 sectors that were identified as being under particular pressure. The site will continue to expand, and I think I alluded to that in my remarks to the Board of Trade over the summer to include training and coaching. So it continues to be built by and for workers, and will continue to have new resources for sectors under particular pressure. Thank you.
Member?
My apologies. I didn't think that program that the Minister cited in January was the one that was announced at the end of March. So my apologies for that. I do have one other question before I pass it over to my colleague from Saanich North and the Islands. Is the budget, as we see it, is slated to stay static over the next 3 years, and without keeping up inflation, is the Minister able to address why that budget continues to stay static? So you clarify the budget for mental health and addictions.
Minister.
Thank you, Madam Chair. So the 2021-22 budget amount that my ministry submitted, argued for and received, and was announced in the finance minister's budget last month, 146 million. The year 2022-23, 165 million. And the year 2023-24, 189 million. So that is not static, that's growing every year. It is a historic commitment in British Columbia for mental health and addictions. Thank you.
Thank you.
Thank you. And just to clarify, that was not the question I asked. The minister asked why the Ministry of Mental Health and Addictions budget was static over the number of years. And I thought I was quite clear on that. But I will point out, before I hand it over to my colleague, that the minister referenced the increases. And we did talk about the 176 overdose deaths that occurred unfortunately, in April. And we are on record to break last year's record, which is absolutely tragic. And I absolutely hope every night that we do not get to that point. But right now we are on a trajectory to exceed that. And the minister pointed out, actually, this year is the lowest funded year in those increases. So I just want to put that on record as the minister talked about the mental health and addiction support, is that this year, while we are facing potentially a record-breaking year, which we all hope is not the case, this is the lowest funded in terms of what the minister just laid out.
I didn't hear a question there, or? There wasn't. Okay, there wasn't one. Minister.
Thank you, Madam Chair. So here are the three-year budget commitments made since 2017, showing that the budget commitment this year for overdose response is on top of existing budget commitments. $322 million over 3 years in 2017, $30 million over 3 years in budget 2019, and then in this year, 2021, $45 million over 3 years. In addition, although it's not specified in the budget documents, and I've alluded to this in questions in the House, that there are dollar amounts that we anticipate receiving in contingencies once some of the mechanics are in place, for example, safe supply, once the agreement around the policy to support expansion of it is in place. And so I anticipate further commitments this budget year and be happy to brief the member on that as they are decided. Thank you.
Thank you, Minister. And now I believe you're handing it over to the member from Saanich North and the Islands.
Yeah. Thank you, Madam Chair, for this opportunity, and it's nice to be in estimates here for mental health and addictions. I just want to ask a question to open coming from the response that the Minister made today in question period in the first question to the Leader of the Official Opposition in referencing tragic spikes and then contextualizing this across the country. And I think one of the frustrations that I've had in some of the language that's been used in the responses is an indirect attempt to, I think, or an attempt to redirect our attention somewhere else. These are not tragic spikes that are being reported month after month. This is a growing issue that we are facing in this province. We haven't gone from 130 to 170, and now we've seen a steady increase. And then as well, to contextualize the questions that we're asking about this issue to what's happening in the country. I think later in question period, in a further question, the Minister responded to, we are the only province to, and then continued on. And I think I'd just like to get the Minister's response to the very serious questions that we're asking in question period about these issues that we're facing as a province, and how necessary it is for the Minister to respond directly to the crisis that we face without having to, I think, pad the responses with what other provinces are failing to do on behalf of their citizens. That's not our responsibility in this House. It's not the Minister's responsibility. It's our responsibility to be asking questions of what we are doing in this province. And what we've seen is not a spike. This is not a one-off. This is a steady increase in drug poisonings in this province. So I just would like to hear the Minister's response to that.
Can I ask the member to put that in the form of a question? It's
Yeah, I was
I
just
imagine
going,
that you can.
I was
Thank
just
you.
going to do that. If we could have questions of the ministry, please, and of the minister, and if that could be framed as a question, then it will be better.
Are we experiencing a spike, or are we seeing a steady, constant increase of drug poisonings and deaths to toxic drug supply in this province?
Thank you, member. Minister.
Thank you, Madam Chair. As noted by the coroner, tragically, we are continuing to see increased incidents of overdoses and increased numbers of overdose deaths, as there are increased spikes in toxicity. And that is since, within the very first month of the pandemic. And it's physical distancing, social distancing, people staying away from supervised consumption sites, and very different compositions of illicit street drugs. This following 2019's drop in overdose deaths, and that trend of dropping overdose deaths carried into the first 2 months of 2020. As soon as the pandemic hit, the terrible loss of life started to rise, and that has continued. Thank you.
Thank you, Minister. Member?
Thank you, Madam Chair. Further to some of the comments that were made just in question period today, and this is around the requests from both parties for involvement or engagement in a committee of some kind, and I recognize that there were some differences between what the two opposition parties offered, but there was, I think, consistency in that the opposition parties were offering to be sitting at the table to be a part of informing the policy going forward and to be brought in and not to be left outside, so that all of the work that we have is either done in question period, which is an incredibly theatrical and public space, and budget estimates. In terms of informing the policy. And the minister says if the solutions were in this legislature or in committees, I think we would have solved them already. Further, the quote was, "I'm appreciative of the support across the aisle for our budget and for our efforts. We will continue to work hard with all parties on the ground to expand supports and save lives." And that was in response to a question about why it was that the opposition parties are not being brought in to this. So my question to the minister is, why is it when the opposition parties have asked and have offered to be constructive partners in this response, that not only have you denied that opportunity, choosing to go it alone, but not only that, but you've kind of undermined the value of the really important institution that we have here that has actually benefited British Columbians to a great extent in a number of different areas. I'm on the Police Act Committee, and we're getting to the bottom of very difficult situations, my colleague here. And that to almost suggest that we're not welcome to be a part of it and is deliberately excluding us from participating. Why has the minister made the choice to exclude the opposition parties from this work and informing this work at a fundamental level, and just to go at this alone?
Minister.
Thank you, Chair. I am very happy to talk with the member about the programs that we are standing up. None of them are legislative, and the work that we're doing with the Overdose Emergency Response Center to stand up prescribed safe supply, the work we're doing with the colleges to try to implement Dr. Bonnie Henry's orders. That is the work at hand that is absolutely urgent inside a public health emergency. That is the work that I regret that I have not already briefed the opposition members on, and I have committed to. I absolutely see value in that, and if we were not in the depths of me in a new role fighting public health emergency and trying to support people on the ground, then those briefings would have happened already. So I look forward to the conversation through this estimates debate on the programs that we are working to implement and carry out based on the advice of frontline service providers. I will look forward to other conversations that we can have outside the budget in other forums. Thank you.
Thank you, Minister and Member.
Thank you, Madam Chair. I think it's important to acknowledge the dramatic difference between briefings, no matter how regular. They could be daily briefings or they could be monthly or weekly briefings, and actually engaging members of the official opposition and the third party in an ongoing dialogue at a committee. The minister's colleague, the Minister of Health, struck one of these committees that had members from both parties, both opposition parties, in the last Parliament, in an effort to build a collaborative response to a particularly challenging issue that may in the end have had a legislative component to it, but it was certainly about building a collaborative, a sense of collaboration, so that we are approaching this as a legislative assembly rather than as parts of the government and then the opposition members. And I think there's incredible benefit to bringing people in, calling people in, inviting them to the table, taking their input, allowing that input to inform the decisions, to have them standing next to the minister when the minister's making statements. It certainly would, I think, completely change the tone of question period, where the members of the opposition are left with very little information, and there's only certain ways that we can get that information. So there is a remarkable difference between a briefing from a minister in a ministry and an engaging process that is collaborative and that is in the spirit of the words of our very own Premier, who said, good ideas come from all parts of the House. That's certainly not been the experience that we've had on this file, and I think that it's important for that to be noted. Another comment that the minister made in question period today was that she didn't want British Columbians to have a feeling that the services aren't there. However, I think that it's really important, and I've been working with a couple of constituents of mine, and the minister knows this. I raised this question in question period, Emma and Ella, about the psychiatric emergency services at the Royal Jubilee Hospital. And they've been collecting stories, as the minister knows, and as the Ministry of Government certainly knows. I think what I'm having a hard time reconciling is the minister standing up in question period and saying, we don't want British Columbians to be led to believe that the services aren't there, and yet the conversations that I'm having on a daily and weekly basis with my constituents are the exact opposite of that. I've had another recent conversation with them, and they let me know that the communication has stopped, that after that was raised in question period, that there's been silence. And yet there was all sorts of great publicity around the fact that the minister and the Premier met with Ella. There was no discussion about what the genesis of that was, that came up in question period. It was we're going to take it forward. And yet I get another call saying, oh, we're going to have to do more work because no more conversations on this. And so I really think that there is a situation here where the minister doesn't want British Columbians to be led to believe that the services aren't there when they need them, but yet story after story after story after story tells me that they're not. And then the stories of them, of the services that they are accessing, there's bias, there's judgment, there's discrimination, there's just outright racism. So I'd like to hear from the minister what it is that that has been done to address the ongoing concerns raised by the community that has grown up around 2,000 people on Facebook, and specifically what actions are being taken with the psychiatric emergency services at the Royal Jubilee Hospital from this ministry.
Minister.
Thank you, Chair. I've got, the update that I have is from the end of March, and I'm sorry, I can't recall when it was that the member raised this in a question period. I have a feeling that it was February. So it may be that it's necessary and important for us to reconnect and find out what's happened most recently. But the update that I received from Island Health, because I had asked following the meeting with the Ella Hale and Emma Epp, both very strong and articulate advocates, and it's a compliment to the MLA that they were able to work so well together and they were able to be so clear. Following the meeting with the Premier and me, Island Health committed to reviewing the psychiatric emergency services space to make sure, to see if it could be reconfigured to provide gender-specific space for patients, committed to reviewing staffing issues and strengthen professional development. Island Health committed to provide information on how to contact the patient care quality office and the regulatory colleges with care concerns. And they provided information to the two women who had raised concerns about the PCQO process. That's an important step in quantifying and investigating complaints. And I'm not aware whether they did actually file a complaint under that patient quality process. The progress that Island Health cites as being underway is strengthening leadership with 7-day-a-week leadership support, developing advanced training opportunities for staff to support the increasing acuity and complexity of mental health and substance use patients who present at Royal Jubilee, increasing involvement of the patient voice and experience, enhancing care transitions between PES and community services. That was something that the women had cited. Implementing post-discharge follow-up, that will begin this month. Exploring options for peer supports and improved support for youth. Increasing psychiatric beds on the Royal Jubilee campus to improve patient flow. Increasing access to counseling and psychotherapy, and strengthening integration with the main Royal Jubilee Emergency Department, which PES is a part of, to ensure a smooth transition for patients between the main emergency department and PES. I'll finish by saying, to me from this list, it's clear that the voice of these two women who had a bad experience, several bad experiences, and brought a community of complaint, that they channeled those forward has clearly led to a lot of process changes within Royal Jubilee. And I do hear from Island Health, they want to deliver care in a dignified and professional and thoughtful way. And I'm encouraged that they were able to initiate all those actions, start to get these process changes underway while fighting a pandemic, while rolling out a mass immunization program. So I'm grateful to our healthcare frontline that are responding and trying to make things better. And in response to the members' earlier comments, I think I try to say every time I answer a public question, there are gaps in the system, there is no doubt, and that is why we are working so hard to build up that system of care. We've got a lot of work to do. We've made progress, but there's a lot of work to do. And voices like these two women have lent to the system are part of identifying where we need to fill those gaps. Thank you.
Thank you, Minister. Member?
Yeah, I have one question, and then I'm going to turn it over to my colleague from Cowichan Valley. And I think that the minister's done a wonderful job of articulating the systems change that Island Health has identified that they're making as a result of these stories coming to light, the most recent stories coming to light. But I'm well aware that PES, or the psychiatric emergency services at Royal Jubilee have been well aware of the shortfalls. There's been lawsuits. There's been a lot of stories about this, and a lot of, I think, stories that have come to me in recent weeks and months of the real shortfall in outcomes. And so I think that it's wonderful that Island Health can identify the systems change, but what we need from PES and what we need from Island Health is outcomes change. I just had a meeting on Friday, and it's a recent situation where the outcomes are awful from this organization. So I'll just ask this question, then I'll cede the floor to my colleague. What is the minister doing to ensure accountability that the systems change that Island Health, and we can write lists of things that need to be done, though all those things have been identified. What are we doing to ensure that the outcomes for people that are being presented? Because one of the probably unintended consequences of this story going public and all of these people sharing these stories without understanding what the proper accountability measures are going to be put in place from government, expecting the outcomes change, is that people now are going to be questioning whether or not that institution is even worth presenting to, because of the stories that have been told about it, that when you go there, you don't get treated well. And that is an overwhelming feeling. So what is the minister doing to ensure that there's accountability to those changes, that Island Health is held to those commitments that they're making, so that we can tell the people in our ridings that would present at this hospital if they're undergoing a mental health crisis, that is a safe place for you to go and get treatment. That's part of our job here, is to instill that confidence in people that we're following through, that we're following up on the commitments that we made, that we're following up on the accountability mechanisms from the health authority, so that when you present at that place, you're going to get the treatment and the care that you need.
Minister.
Thank you, Chair, and thank you to the member for the question. Health authorities are now reporting to me as Minister of Mental Health and Addictions on matters related to mental health and addictions, as well as reporting to Minister Dix. We are working well together, and there are stats that are generated and learnings generated by the Patient Care Quality Office. That is an established process in law. That's a very important place. I urge the member and all members to let us know what they're hearing from their constituents. I hear stories like this too, and this is why we are deepening our investment and our commitment to building up that system of care, and with the majority of the investment going through the health authorities so that they can deliver under an extremely difficult mental health, COVID, and overdose crisis simultaneously. So the reporting and accountability is through me, and I look forward to learning more from the member about outcomes of his constituents relating their care experiences and making sure that we continuously build that better system of care. We don't want anybody to fall through the cracks. We don't want young people to fall through the cracks. Particularly, it can have lifelong impacts, and we're determined to build that system of care that better supports people. Thank you.
Thank you. Okay, thank you. We now have the leader of the third party joining us. Welcome to Estimates, and over to you.
Thank you, Madam Chair. Delighted to be here. Always a great opportunity to be able to ask some questions. I think we'll start with, of course, picking up from where my colleague was leaving off, but also the coroner's report came out today. Coroner's reports have been coming out month over month. It's been a relentless trend of increasing number of deaths from a very poisonous, very toxic drug supply that seems to be, from all indications in the reports, getting more poisonous and more toxic, more chaotic. We know that this drug supply is also related to the violence we're seeing in the gang violence, particularly on the Lower Mainland. And we've had a relatively similar response month over month from government. You know, we're working on things. There's treatment beds coming, Pathway to Hope. However, what experts are consistently calling for, what advocates, drug policy experts, health experts, there is one consistent call, which is for a accessible, regulated, safe supply. That the chaos of the illicit drug supply right now, being exacerbated month over month by its increasing toxicity, means that unless something changes radically, we're going to keep seeing hundreds of people die month over month. And so I know that the minister has talked about a 22.6 million increase to the expansion of safe supply. I think in Dr. Henry's report, at the time that came out, she identified over, I think it was 120,000 drug users in British Columbia. There's a Vancouver Island Construction Association report that just came out. We were reviewing it locally. There's a significant use of illicit drugs happening in the trades and construction industry. We know that people are dying, for the most part, in their homes, in private residences. Young people are dying. So I guess to start with, what are the impediments to moving forward urgently with a truly accessible, regulated, safe supply in British Columbia to not only reduce the deaths that we're seeing, but the harm and the chaos that is connected to the illicit drug supply right now.
Through you, Madam Chair, just for clarification, is the member talking about a prescribed safe supply or some other model?
Thank you, Madam Chair, and thank you to the Minister for the clarification. Again, what we have been hearing consistently, and I'm sure that the Minister has also been hearing this from drug policy experts and advocates, is that by accessible, I mean low barrier, right? That even the barrier of having to get a prescription can mean that people are not accessing a safe supply. So a low barrier, accessible, regulated, safe supply.
Minister.
Thank you, Chair. And thank you to the member. I imagine that we're going to have a little bit of dialogue back and forth on this, so I'm going to start with the work that we are doing. And also for the benefit of the public, if anybody is watching this, I do because I don't think this is maybe widely understood by members of the public, and it is still a relatively new approach in British Columbia. I want to make sure that we get on the record the programs that are being pursued. Again, as a way to separate people from the increasingly toxic drug supply, what we call prescribed safe supply. Used to be called, maybe more in British Columbia, pharmaceutical alternatives. To us, this is safe supply, and the intention is that it creates options for people who have been unsuccessful with traditional treatment. This is something that exists along the continuum of care. Some people are on medication-assisted treatment, which actually is treatment, and that's a different category. Opioid agonist therapy, also called OAT, would fit into that category. But we're talking about is something that simply is intended to support someone's physical addiction, again, to separate them from the toxic illicit drug supply. The design of the program is that it have as few barriers as possible. That includes flexible eligibility requirements, unobserved dosing. It includes highly clinical models of opioid agonist treatment on the other end, which is witnessed and multiple witnessed daily doses. But that's not what we're talking about here. These alternatives are meant to provide low barrier options, flexible options. They do not carry the expectation that people will enter treatment or reduce overall substance use. But arguably, they keep people alive so that it leaves that option open to them. So in a year ago, or just 2 weeks into the pandemic, prescribed safe supply was stood up with the support of Dr. Bonnie Henry, the Public Health Officer of British Columbia. In September 2020, the province announced that a policy directive would be developed to increase access to those that prescribed safe supply. And that is targeted health system, public health order. It's part of, again, the whole continuum of approaches to addressing addiction to illegal opioids and stimulants. So that September policy directive is, and this is about the barriers that the member mentioned, it continues to be working under development. This is a shared responsibility of our ministry, the Ministry of Health, the Office of the Provincial Health Officer. We are working alongside the BC Centre for Substance Use, many people with lived and living experience, colleges and physicians and surgeons and prescribers. And it's our ministry Overdose Emergency Response Center that has been heading up all this work. We are going to have news on this, I think, quite soon on this next wave of the policy directive that was first initiated back in September. And again, because it hasn't been done in Canada before, it is complex work. It's taking longer than any of us would want, but it's all being done with patient safety at the forefront. And it has to be done in lockstep, in tandem with the expertise of the prescribers, the addiction medicine doctors. Working as fast as we can to do work that within our federal model as a province is breaking new ground in Canada. Thank you.
Member of the leader of the third party.
Thank you, Madam Chair. And I appreciate the Minister's response, and I think that there have certainly been steps taken. However, what seems to not exist fully is the recognition of the emergency of this, that the emergency of how many lives are being lost day over day over day, and that accessing the illicit drug supply means taking one's life, putting one's life at risk, right? That it is it has become so toxic that there is this imminent risk to anybody who uses drugs in this province who is accessing the illicit drug supply. And so we've had a health emergency declared for 5 years. We know that long before that, the numbers of deaths and harm from the illicit drug supply was growing. And now we are at a point where, I think my colleague mentioned this, but per capita, I think we're only behind West Virginia in terms of death from illicit drug supply in BC. We are second in North America by jurisdiction. It is truly an emergency. And so for a person in British Columbia right now who uses drugs, they have very limited choices about accessing drugs without being very seriously at risk to their own health and their life. And so the pace of response doesn't seem to match the emergency now. We compare it to the other health emergency that we're in. A year ago, just over a year ago, came into this building, spent one day in here and passed $5 billion in spending to address a health emergency. And this health emergency doesn't seem to have the same sense of collective urgency that the COVID health emergency generated and continues to generate. We don't stand up every day and announce how many deaths there have been from the illicit drug supply. But maybe if we did, maybe if you stood maybe if the minister stood next to the health minister and identified that would elevate this health emergency to the level that I think we can all agree it needs to be elevated to. And so just in terms of, again, on access to a regulated, safe supply, what the minister has described, does the minister think that in any way matches the reality of over 100,000 drug users in British Columbia who are at risk because of the toxicity of the current illicit drug supply, on top of the growing mental health impacts that we know and are being documented and are being spoken about by mental health and health professionals widely, and that the growing risk of harm and death is increasing with the collision of these two health emergencies. So again, I guess I'll restate my question. What are the impediments to seeing the response match the scale of the emergency in terms of over 100,000 British Columbians who use drugs, who are at risk because of the poisonous drug supply?
Thank you to Leader of the Third Party. I'm going to remind everyone, please ask questions through the chair and not get into. we are going to be taking a recess for 10 minutes. And I've always wanted to say this, we are having technical difficulties. Recess for 10 minutes. but I'm going to wait to make sure that we have enough people online. Because we did say a 10-minute break, and I don't think it's been quite 10 minutes. But the technical system has been fixed. Okay, if you can hear me, wave. communicating with you through chat, because in this room, it's like a den. Okay, I have to go to the, ask the minister to move the motion.
Honorable Chair, I move that the committee rise, report resolution and completion of the estimates of Ministry of Labor and report progress on the Ministry of Mental Health and Addictions, and ask leave to sit again.
Members, a vote is about to take place, and those participating remotely should prepare their voting cards. Members, the question is that the committee rise, report resolution and completion of the estimates of the Ministry of Labor, and report progress on the estimates of the Ministry of Mental Health and Addictions, and seek leave to sit again. Those in favor indicate aye. Those opposed indicate nay. Motion is carried. Thank you, members. The committee now stands adjourned.